Hi, this is Dr. Vivek, and in today's video, let me share with you my experiences with treating the patients with IBS, that's irritable bowel syndrome. I'll be sharing my views, and I hope today's video will be helpful for you. So the first thing that I have found is effective is increasing the good gut bacteria. What I have found is these patients who are suffering from IBS, they at some point of their treatment are prescribed antibiotics. They go through antibiotics, and yes, they feel a little bit of relief for a short period of time. But this comes with lots of side effects. So after this treatment finishes, then the problem starts. But what I have noticed is if I recommend use of probiotics or the food that is rich in probiotics, this helps. But if a person is severely suffering, then I recommend to directly supplement for a month probiotics and then can try to get it from the food, because many times the food that is rich in probiotics can cause gas, bloating, flatulence, means the discomfort, and this gives psychological effects to the patient who are suffering from IBS. No, I don't endorse any of it. You can see which is the best available near to you. Go with that probiotic supplement, and maybe probiotic supplement will give you a bit help. Before moving forward, just want to remind you about my 11 days Panchakarma retreat that is going to happen in Kerala from 18th of July to 29th of July. So if you are interested in detoxifying your body, or if you are looking forward for treatment from me, then see you in Kerala from 18th of July to 29th of July. If you are interested and if you want to know more, then the link I'll put in the description box down below. Also, I'll try to pin it in the comments box. If you need help, then see you in Kerala from 18th of July to 29th of July. Second, and the most important thing that I have noticed is, in case of IBS, stress management is must. With my practice, my experience, I can say that always 100% of the patients that I have seen in my practice with IBS, their IBS kicks on the time when there is lots of stress going on in their life. So if you want some relief with your IBS symptoms, it's very, very important to balance the stress in your life, to do some stress relieving practices. For example, yoga, some stretching, Pilates, any form of exercise will be helpful. Breathing exercises are awesome. You should be doing deep breathing exercises. For example, Anulom Vilom. Then there is Brahmari. So these are two that I can recommend, but there are many other. See what works good for you. Start doing breathing exercises. Don't think that, oh, it's just breathing exercises and all. Don't take them lightly. No. They are like medicines. So do them for a month or two, and surely you will see benefits of doing breathing exercises every day. If you don't have time, do it just for a minute, but do breathing exercises every single day. They are going to be very, very beneficial for you. And yes, meditation can be also helpful. Learn how to do the basic meditation, not the hard one or where you have to sit for half an hour or more. No, just for a minute or two. That is also sufficient to start with meditation. I don't want to give you any, philosophical advices, but these are the things that are going to help you. These are real. I will share with you name of the Ayurvedic medicines that can be helpful, but I don't want you to eat the Ayurvedic medicines also for whole of your life, right? So doing breathing exercises or doing exercises is going to help you for all of your life, and that too in many aspects of your life, not only with IBS. So start working on stress management, and surely you are going to see improvement with IBS, that's for sure. And I tell you, many of my patients who have been suffering from IBS for a long period of time, at the last, doctors prescribe them antidepressants. So this is going to happen, or this might have happened with you. That's why I'm giving you alternatives of stress management by doing yoga, breathing exercises, meditation, these kinds of things. Even any form of exercise will also be very, very helpful. Now, some dietary recommendations. It's better to cut down on anything that has caffeine in it, especially coffees and all. Cut down on it, and this will be helpful. You have to stop eating fried food, junk food, oils, dairy food, and other fatty foods. Just cut down on them, and there will be improvement. Avoid the food that causes flatulence. It can be cabbage, it can be broccoli, it can be Brussels sprouts, all these kinds of stuff. try to avoid them. And also try to avoid too spicy food. See, too spicy food is going to create the spasm in your intestine, which can cause diarrhea. So it's better to avoid these kinds of foods. Even I will advise to avoid capsicums also for a short period of time. But there is one drink that can be very helpful, and that is buttermilk. Drinking buttermilk every single day, even you can drink it for about a liter in a day, is going to be very helpful. When you will be drinking buttermilk, try to avoid using the salt in it. Instead of salt, add cumin powder according to your taste. Mix it and start drinking buttermilk. At least a glass a day you should be drinking, and this is going to heal your gut. According to Ayurveda, the holistic medical science, buttermilk is best to treat any of the gut issues. So if you want to have healthy gut, if you don't want to suffer from IBS, then buttermilk is helpful. Drink it, make a habit of drinking throughout the year for whole of your life. You are going to have a healthy gut. Yes, you have to eat on time, you have to sleep on time. Just buttermilk is not going to do just magic, but it is going to aid in the treatment. Now, if you talk about the Ayurvedic medicines that I have seen works, is Bilvadi Lahiyam. I know it's hard. That's why I'm writing it on the internet. There are many companies who make it. You can see which is easily available near to you. Start using Bilvadi Lahiyam. If the condition is chronic, you can take 1 teaspoon 4 or 5 times in a day. But if the condition is not so bad, you can take 1 teaspoon 2 times in a day also. That will be sufficient. So if the condition is severe, then 4 to 5 teaspoons in a day can also be taken, but not for a long period of time, for about 20 days, and then you can decrease the dose. Yes, of course, it will be better if you'll consult to an Ayurvedic doctor near to you, so that they can guide you properly what medicines to take and how to treat it. And yes, IBS, that's irritable bowel syndrome, and IBD, that's irritable bowel disease. In both the disease, you can find big relief with the help of Ayurveda, and you don't always need steroids to treat these diseases. This I have seen in my practice, and there are many people who are getting help through Ayurveda. So you can consult to a good Ayurvedic doctor near to you who can guide you with the treatment. So yes, treatment is available with IBS or IBD with Ayurveda. Now, if we talk about the teas that can be helpful, then peppermint tea and chamomile tea. Both of these teas are very helpful in the treatment. These teas are going to help to decrease the cramps, the discomfort, the flatulence, the gas, bloating, these kinds of feelings that these patients have. And these teas can be used every single day. And one thing I want to point out over here, that if you are suffering from heartburn, then it will be better for you to choose chamomile tea over peppermint tea. If you're not suffering from heartburn, then you can try which works good for you. But if you have heartburn or refluxes, then it will be better to go with chamomile tea. Now let's talk about the vitamins. Vitamin D3 is the most important one. You should be taking about 7 to 10,000 IUs every single day. You can take it for 2 to 3 months and see how your body is reacting to it. Vitamin D3 is a fat-soluble vitamin, so it should be taken in the morning with food or after food. But if in your country there are only 60,000 IU capsules available, then you can take 1 capsule in a week. You can fix a day. It can be Sunday, Monday, any of the day. Take it in the morning with your breakfast, and that's it. You don't have to take it every single day if it's available in 50,000 or 60,000 IU dose in your country. So these are some of my simple tips. Try them out. I very much hope that these things will be helpful for you. I have tried my best, and I hope you felt it also. See you next video with a big smile. Up to the time, smile more, stay happy, stay healthy.